Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is an editorially independent program made possible with advertising support from Ortho Dermatologics.
The NPF expands services to patients. A new SK therapy launches this spring. And a look at research presented at the annual meeting of the AAD. Ahead on DermWire TV. Welcome to DermWire TV from the editors of Practical Dermatology magazine and DermWire.com. I'm your host, Rana Jaraha. The National Psoriasis Foundation is expanding its services to patients with a special focus on teens affected by the skin disease. The Our Spot resource for kids and teens living with psoriatic disease includes a website and welcome kit with age-appropriate information and resources to help support the needs of young people living with psoriatic disease. In addition, NPF has expanded its Patient Navigator service to support patients and even assist dermatologists who treat psoriasis. Leah Howard of the National Psoriasis Foundation spoke to DermWire.com about the association's services.
Patient Navigation Center launched in February of 2016, so we've now celebrated 2 years since the center opened, and really this is the first free personalized resource for patients to go to receive any sort of information that would support them on their patient journey. And we know that even when patients are receiving the best care, working with their healthcare provider, that many still struggle in order to manage their disease. And so really this center provides a resource for all individuals.
More information about NPF programs is available at psoriasis.org. Seborrheic keratosis, or SK, affects 83 million adults across the U.S. Treatment options have been limited. Late last year, FDA approved Escada hydrogen peroxide topical solution 40% from Aclaris Therapeutics for the treatment of SK. Widely anticipated by both physicians and patients, Escada will be available for in-office use this spring. Aclaris CEO Dr. Neil Walker addressed the launch as well as the pipeline for Aclaris.
We're going to take the first quarter to continue to build out our sales infrastructure and getting reps out to the office to inform them about the new product and how to use it and how best to position the product for success. And we expect to have our national sales meeting in the back part of April and then go live with our formal launch in the first week in May. We have an asset for the treatment of common warts. It's a topical treatment that we just reported out very positive data in January of this year from 2 large phase 2b studies, and in that we showed with twice weekly treatment over 8 weeks highly statistically significant clearance rates by the end of the study. And so we're excited to move that now to a phase 3 program in the back part of this year.
Aclaris is also developing a JAK inhibitor for alopecia areata and vitiligo. New clinical research takes center stage at the annual meeting of the AAD every year. Paul Winnington, editorial director for Practical Dermatology magazine, offers a look at some of the new data presented at the meeting in San Diego.
Dr. Jennifer Cather led a new study that assessed the beneficial impact of izokizumab, or Taltz, from Lilly on genital psoriasis. Research suggests that up to 63% of patients with psoriasis will have genital involvement at some point during the disease course. Genital psoriasis may appear different than psoriasis on other body areas. It may be under-recognized, and patients may not address it with their dermatologist. Dr. Cather addressed the problem of genital psoriasis.
Even before this study was done, we had kind of some insight that genital psoriasis is usually not discussed with healthcare providers. It's not usually discussed with partners, by the way. It's usually hidden, and then when people are not flaring, then they'll engage in sexual activities.
Dr. Cather urges early initiation of therapy.
This is what I think you have. I could see a dermatologist saying, look, let's try this. I want to see you back in 2 weeks. If it's not getting better, then you really do need to escalate therapy to treat them appropriately. And I also ask people where they've been, by the way. So, to get to see a dermatologist this day, you've usually been around the block once or twice, and sometimes they've seen their internist, and their internist has used, like a potent steroid and an antifungal combo. You don't need to redo things. You have treatment failures, and we do that first visit on a systemic for genital psoriasis. So you don't need to wait around.
Ortho Dermatologics, a division of Valeant Pharmaceuticals North America, shared results from an analysis of the Phase 3 clinical trial Imagine 1, which evaluated mental health comorbidities associated with psoriasis, such as anxiety and depression. Results from the Phase 3 randomized controlled clinical trial suggest that treatment with Silique reduced anxiety and depression in patients with moderate to severe plaque psoriasis. After 12 weeks of Silique treatment, patients experienced a decrease in depression and anxiety scores, while scores remained unaffected in those receiving placebo. Finally, results from Galderma's Phase 4 Oscar study, originally presented at the 42nd Hawaii Dermatology Seminar and addressed at the AAD annual meeting, reveal that Epiduo Forte decreased acne lesions as measured over a 24-week period and reduced the risk of atrophic acne scars in patients with moderate to severe acne. The split-face study compared Epiduo Forte to vehicle only. Dr. Hilary Baldwin addressed the data.
Not only were there fewer scars forming, in fact, no scars forming on the treated side, but there was actually a reduction in existing scars, because these kids had scars going into the trial, and now they were getting fewer scars as time went on. So at the end of the study, there was a 30% difference in scars between the treated and the untreated side. So not only did Epiduo Forte prevent the development of scars, but it actually helps some of them to resolve. The fact that you can make acne better and reduce scars at the same time, I think, is the new concept. That why wouldn't you use something like this to make the acne better if you can kill two birds with one stone? I also didn't know that a scar could get better.
More information is available at DermWire.com and in the March edition of Practical Dermatology magazine. It's Retinoid Education Week. Differin launched the initiative to educate the more than 50 million Americans with acne about how retinoids can be used to treat their condition. Part of Nestle Skin Health's acne franchise, Differin is new to the over-the-counter acne category. That's it for this edition of DermWire TV. Get updates anytime at DermWire.com or ask Alexa to play Dermatology News. Thanks for watching.
Thank you for listening to this edition of DermWire News, powered by DermWire.com. DermWire News is an editorially independent program made possible with advertising by Ortho Dermatologics.